Welcome to this event hosted by the Chartered Quality Institute, the professional body for quality professionals and quality auditors.
Quality has many definitions, and on the basis of simplicity, the one I refer to or prefer refers to the systems, processes and practices an organisation uses in producing what its customers want. In basic terms, understanding what your customer wants and giving it to them efficiently. We see today's event as having a number of contexts, not just the most obvious, which is the coalition slimming down of the public sector and the doing more with less implications. The recession, the downturn is of course wider than the public sector and has hit everyone. Quality and the need to practice quality is equally relevant to the private sector, equally relevant to those organisations who compete globally, relevant to industry, to manufacturing, equally relevant to those offering services and products. Time, we would say, for quality, time for the quality profession to step up, time for us as organisations, as an economy and as a country to be receptive to the quality message and to do quality.
If we want to make our way through this crisis, then we have to think about shifting from command and control organisational cultures, things that are much more open and allow individual employees and indeed groups of workers to influence what's happening in the workplace, as well as simply saying, let managers decide and it's all going to be fine.
The most important approach that the CBI wants to see taken, and the way that we think we'll get quality in public services, is if we re-engineer what those public services do. We have to use this opportunity in the CSR to thoroughly reassess what we do.
I think in public sector, and particularly local governments, a while ago, people started to concentrate probably on price rather than quality. And in the years of CCT, we looked at what the bottom line was for everything. But I think things are probably changing now, so that we're probably less ideological now about how we operate. People are really just interested in getting decent outcomes from wherever they come from.
If you're going to have competition within public services, where the assessment of quality by users, and this is a point that David made, the assessment of quality by users is difficult, it might be better not to have competition on price, but to have competition on quality.
Nothing impacts on reputation quite like quality. Time to market, price do not impact on reputation in the same way that quality does. Engineers wouldn't dream of allowing themselves to be called product. People working in oncology wouldn't dare call themselves health. Why do we describe what we do as a profession in terms of an outcome? It's beyond me.
How can the Chartered Quality Institute, or how should the Chartered Quality Institute help the public sector?
CQI, from the local government point of view, I think it would be very useful to have more contacts between yourself and local government improvement and development. It used to be called until a couple of weeks ago the Improvement and Development Agency, whose job it is to drive good ideas and good practice through local government.
We need to have the data out there so that people using public services can genuinely see what they're getting and how that compares with elsewhere. We need a plurality of provision so that people have some choice within it. And we need to empower the people using public services.
Think of one thing that the coalition government might be able to do that would actually drive up quality at the same time as we are cutting costs.
They could do a lot worse than look at place-based budgeting. There is huge amounts of public sector money that is wasted by masses of different organisations trying to do the same thing.
We have to have a quite profound conversation about how we organise capitalism in the UK before we can begin to create a culture that enables quality professionals to do what they're very good at doing.
We need some transparency, we need some new ideas, an injection of new ideas into public services, matched with a right to bid, not just from the private sector, but from hopefully social enterprises and cooperatives.
Employee-owned organisations, and that might be quite an effective way of raising morale, raising outcomes and improving the quality of our public services.
Perhaps a cultural understanding of who we're doing this for. What are the services for? Who's it for? Is it for the providers of the service, or is it for the users?
Yes, can I thank you all very much for coming, for contributing, and can you please thank your panel for their excellent contributions.